Hello, dear friends. I'm Jerry from USIB. Thank you for watching Dialogue with Super Doctors, presented by USIB. The purpose of this program is to share with you the latest knowledge of fertility medical treatments and the services available in the United States. 大家好，我是来自美中桥的 Jerry， 非常感谢大家收看我们今天的与超级医生对话栏目。这一档栏目的宗旨是为大家带来最先进的美国生育医疗技术和服务信息。Today we have the great pleasure to invite Dr. Daneshmand from San Diego Fertility Center to join us. San Diego Fertility Center is based in the city of San Diego, California, and is one of the top fertility clinics in the United States. San Diego Fertility Center is enjoying a very high reputation for its top IVF success rate, best quality medical care, and also state-of-art facilities. Dr. Daneshmand is one of the top fertility specialists in the United States. He has very extensive experience in third-party reproductive services. Thank you for joining us today, Dr. Daneshmand. So may I call you Dr. D?
Absolutely.
Thank you. Let's start with the basics. So first of all, can you give our audience an introduction of yourself as well as SDFC Clinic?
Absolutely. It's really a pleasure to be here amongst you and my colleagues at USIB today, introducing San Diego Fertility Center. At San Diego Fertility Center, our clinic was founded in 1989, so we have almost 30 years experience in the field of IVF, and especially in the field of third-party reproductive services. I myself, with 4 of my partners, Dr. Chuan, Dr. Kettle, Dr. Park, and Dr. Friedman, enjoy a great deal of experience, skill in the field of infertility. We have also especially done a great deal of research in the field of IVF, geared towards increasing pregnancy rates and taking the pregnancy rates to a different level, enjoying now one of the highest rates of pregnancy success in the field of IVF and third-party services at San Diego Fertility Center. We also have at San Diego Fertility Center our own egg donor database that we welcome our Chinese patients to use. And we also have a great deal of confidence in our success so that we are able to offer something called a success guarantee program, which essentially means that if a patient or a couple is not able to achieve a live birth and a healthy delivery after one cycle, then all the clinic fees are returned back to them. So we're really excited about taking care of patients and intended parents from China. We have a great deal of experience presenting our research to our colleagues and doctors in China, and it's really a pleasure always to come to China to see intended parents, to help them through the journey to parenthood.
That's such an impressive introduction of your clinic. So as you mentioned, Doctor, SDFC has done a lot of hard work to increase IVF success rate. So research data shows that the infertility rate globally is getting higher and higher. I know that in the United States, about 11% of the total population are having this infertility problem. Meanwhile, in China, the number is even higher. What do you think are the main causes of this growing infertility issue?
That's right, Jerry. We have seen this trend of increasing fertility services around the world and globally. Anywhere between 10 to 15% of couples are having trouble conceiving. Now, there could be many reasons for this. One of the reasons, for example, could be that couples are attempting conception at a later age. As you know, women, for example, are born with all the eggs they're going to have throughout their lifetime. And as they get older, both the number and the quality of the eggs in their ovaries start to decline, especially after 34 years of age. So certainly decreasing and declining egg quality could be one of the main factors for increasing fertility services. The other thing could be environmental factors. Now, as you know, with great global technological advances, there's also been great increases in global pollution, whether it's the waters, it's the air, and possibly even our diet and food sources could be contributing to an increase in hormonal imbalances, increase in the incidence of infertility, possibly as a result of a decrease in egg quality and sperm quality because of exposure to these particular toxins and environmental factors. We also know that as the success rates in infertility treatment has increased, more and more people have sought services. For example, now in the next generation of in vitro fertilization that we employ at San Diego Fertility Center, we're able to improve the quality of the eggs and the sperm prior to collection of the egg and sperm in order to maximize a chance of pregnancy. As you know, in the first generation of IVF, we would put sperm and egg together, let the embryos grow to day 3, and then transfer the embryos. In the next generation of IVF, we actually selected the best quality sperm to inject inside the eggs. Therefore, we would solve the problem of decreased sperm quality that many men suffered from. In the third generation, we actually are able to assess the genetic normality and chromosomal normality of embryos prior to transfer. And now we have a whole next generation of IVF technology that we're able to potentially improve the success rates by improving the quality of the eggs that are produced in an IVF cycle and also improving the quality of the sperm that is collected at the time of egg retrieval. So I think these are very exciting times in the field of in vitro fertilization. We've really been able to push the frontiers of pregnancy success. We started off with pregnancy success in the ranges of 10 to 15% about 20 years ago, and now we're pushing above 90% in selected cases with egg donation and surrogacy services. So I think it's very exciting times.
Thank you. That's very impressive news.
Thank you.
So we are knowing that the technology are advancing from third generation to maybe a new generation of fertility treatments.
Absolutely, absolutely. And that's why it's so important for us to have a very detailed consultation with our intended parents, with our patients from China, before we devise a treatment plan. So our goal is to know exactly what their condition is like, exactly what kind of diet they have, what medications they're on, what exposures they have, and then basically prior to the start of IVF cycles, see if we can improve the conditions to improve sperm and egg quality so that once they do come to the United States for their fertility treatment, we're able to get the best quality eggs and sperm. Can help us improve pregnancy success, and also once patients are pregnant, improve the health of the pregnancy so that our patients can have healthy children.
That involves lots of detailed information collection.
Yes, it does. It does, and it takes work, and I think that with our partners here in China, USIB, we're able to work together hand in hand to help the intended parents here in China.
Yes, I think so. So that's how we can provide these personalized treatment plans for the intended parents. That's different from China's current situation, because usually Chinese hospital will provide very unified treatment plans, but in your clinic, you can provide personalized.
Absolutely. I think that's correct. I think we're going to spend a great deal of time providing the personalized service to all of our patients from China.
So, doctor, we are seeing more and more Chinese intended parents are choosing United States as their destination for fertility treatments. Right. What do you think are the reasons for them to make such a decision?
I think the United States has always enjoyed one of the highest success rates in the world in the field of in vitro fertilization. One is, I think, research. I think the United States is one of the leaders in the field of research, research into how we can improve pregnancy rates in the field of IVF, how we can improve the health of the pregnancies after patients are pregnant. And also, I do believe that there are some services in the United States that may not be offered outside in other countries. For example, next generation sequencing, gender selection, egg freezing, for example, for women who fear that if they don't freeze their eggs, they potentially may run out of good quality eggs and not have an ability and a chance to have their children in the future. I also think that there are a group of services called third-party reproductive services. This includes services such as egg donation and surrogacy. As you know, many of our LGBT clients and intended parents would like to use an egg donor and a surrogate in order to be able to achieve their goal of parenthood. And those are some of the things that are available in the United States and unfortunately not available in many countries outside the US. So I think that is one of the reasons why we've seen sort of this incredible growth in the number of patients from all around the world, including from China, to the United States.
So can I conclude that for two reasons? So first, United States has the best and the most advanced technology in fertility treatments. Second, there are many services that are not available outside the United States. Like you mentioned, the third-party reproductive and other things like PGS, gender selection, things like that.
Exactly right.
Well, now let's say that we have a couple deciding to receive their fertility treatments in your clinic, SDFC. So what pre-testings are required before they start?
Sure, that's a great question. So there are two essential things that we really need. We want to make sure that we assess the sperm quality by a detailed sperm analysis, looking at areas like concentration, motility, morphology of the sperm, and the progression of the motility, something called progressive motility. We also want to make sure that we get an assessment of egg quality as well. And we do that by hormone levels that are typically done on cycle day 2 or cycle day 3. We would like our patients here in China to obtain an antral follicle count or an immature egg count by ultrasound, and a hormone called AMH. Now, if they're also carrying the pregnancy, we want to get an evaluation of the uterus, and sometimes we can do that through a test called saline sonogram, where fluid is injected into the uterus and the inside of the cavity of the uterus is analyzed. If that's not available, then a hysterosalpingogram is also a tool that we can use to assess the uterus. But really a specialized ultrasound looking at the uterine dimensions, looking at the ovaries, looking at the immature egg count is really critical for us to be able to then tailor an individualized treatment for that particular patient. The sperm analysis is important if men have abnormal sperm parameters. For example, if the count is low, the motility is low, the morphology is low. There are some treatments available for those particular conditions. So we want to initially get a sperm analysis, and then we may do further testing after we find out about the sperm parameters through genetic screening and also hormonal testing in order to find out if we can provide treatment and medications beforehand to improve the quality of the sperm. We also want our patients in China to obtain testing such as thyroid, prolactin. We also obtain vitamin levels, for example, vitamin D levels, in order to make sure that they have adequate supply of vitamin D. And of course, infectious disease screening for both male sperm providers and also egg providers as well. We will review all the pre-screening tests with our Chinese team in the United States and then determine if any further testing is required. And the whole goal is to make sure that we maximize the quality of the sperm and the eggs. And of course, if our patients are going to be carrying the pregnancy and we're going to transfer, making sure the uterus is in ideal shape before transfer of the embryos into the uterus.
That's very helpful for our intended parents before they go to the United States. Now they know what tests they should go and what preparations they should do while they are in China.
Absolutely.
Going to the United States is actually very long distance international travel.
Sure.
So our intended parents want to know how long does it take to complete IVF cycle in SDFC, and what major procedures are involved in the IVF cycle?
So typically an IVF stimulation cycle will take anywhere between 12 to 14 days. So ideally we'd want our patients from China, if they're going through an IVF stimulation cycle with an egg retrieval, to stay with us for approximately 2 weeks for the duration of the cycle. Now sometimes if that's not possible, we may be able to do some initial monitoring in China for the first 6-7 days and then shorten the visit over in the United States to about 7-8 days. We would have to find a facility here in China, and of course we do have collaborations with doctors here in China to be able to do a baseline ultrasound, to do some hormone testing. Now during IVF, as you know, patients are administering medications, injectable hormones to stimulate their ovaries and mature and develop eggs. During the time when we are monitoring the egg development, we actually have to make sometimes adjustments in the dosage and the type of medications we administer. During the IVF cycle, we obtain blood hormone levels and ultrasounds frequently, anywhere between 2 to 4 day intervals, in order to make sure the eggs are developing well and make sure that before we take the eggs out, that the eggs are mature. It's really critical for us to review those ultrasounds and blood work at regular intervals during the IVF to maximize the chance of obtaining good quality, healthy eggs from the ovaries.
So, Dr. D, another very frequently asked question from our Chinese patient is about fresh embryo transfer and frozen embryo transfer. They will often ask, which one is a better way to do it? Because they care so much about the success rate and the live birth rate. So fresh or frozen, which one is better?
That's a very critical question, Jerry, and the reason for that is because if an embryo is good quality and healthy chromosomally, and we transfer a good quality embryo into the uterus, unless the uterus is receptive and we're transferring it during the time of the window of implantation, we may not achieve a pregnancy. So many years ago, we saw this phenomenon where good quality embryos were transferred into the uterus, and yet we didn't get a pregnancy in fresh IVF cycles. So back in 2008, we started a series of randomized controlled research trials comparing fresh versus frozen. The research that we did was the first of its kind anywhere in the world. There had never been a randomized controlled trial looking at fresh versus frozen. The very interesting result of that particular research that was conducted over a course of over 5 years was that the frozen embryo transfer pregnancy rates were higher than the fresh when IVF stimulation was performed in the patient. The reason for that is because the ovaries produce hormones, and those hormones during the course of IVF stimulation can have a negative impact on the uterus and make the uterus less receptive. So if we're doing the IVF stimulation and the ovaries are producing all of these hormone byproducts, then the uterus is going to have a shorter window of implantation, be less receptive, so the pregnancy rates are going to be lower. So now what we've done is we've separated the IVF stimulation and egg retrieval from the transfer. We obtain and retrieve eggs, fertilize them, let them develop to the blastocyst stage, do the PGS or the NGS, next generation sequencing, freeze them, and then what we do is we prepare the uterus independently to maximize a chance of uterine receptivity and therefore maximize a chance of a healthy delivery. And these are some of the studies that we had published. And if you look at the total number of IVF cycles in the United States, from the time of the publication of our studies, once our studies became more well known, more and more centers around the world started doing more frozen embryo transfers, to the point where if you look at the population of IVF cycles now in the United States, more frozen embryo transfers are done now than fresh embryo transfers.
So now that explains some patients' misunderstanding about fresh embryo transfer is always better than frozen embryo transfer.
Exactly right. Now, there are some instances where fresh and frozen embryo transfer are going to be equally as effective. For example, in egg donation cycles where the uterus is being prepared independently and the egg donor is going through an IVF stimulation. In those particular instances, fresh and frozen are going to have similar pregnancy rates. Even in surrogacy cycles where an egg donor is selected, or when a patient is going through an IVF cycle and the resulting embryos are going to be transferred to a surrogate, in those instances, again, fresh and frozen are going to yield similar pregnancy rates results. And the reason for that is because those two events are independent. Preparation of the uterus is done independently, and preparation of the eggs and the embryos are done independently. But in the patients who are going through IVF with their own eggs, and the transfer is going to be done to their own uterus, the frozen embryo transfer pregnancy rates have yielded higher results.
Okay, I see. So that depends on different circumstances.
Exactly right. Exactly right.
There's no saying that which one is absolutely better.
Exactly right. Fresh can be as good as frozen,
yes,
but in many, many instances, frozen is going to be superior to fresh embryo transfers.
I see. So, Dr. D, with more and more Chinese intended parents going to US, going to SDFC for IVF treatments, what services are provided by SDFC to better serve these patients and the intended parents?
That's a great question, Jerry. And we want our Chinese patients to feel at home and feel very welcome when they come to San Diego. As you know, San Diego is a beautiful city with lots of different attractions. And we want our patients from China to feel less stressed as they go through the IVF cycle. So one of the things that we have done is we have a Chinese team at San Diego Fertility Center to welcome our patients from China. We have at San Diego Fertility Center Chinese nurses, translators, even our one of our financial representatives is Chinese, so that they can guide the patients throughout the whole journey to parenthood. We also have concierge services at San Diego Fertility Center and in San Diego, for help with transportation of patients by car or by train, especially as they arrive, for example, in San Diego Airport or Los Angeles Airport. We provide transportation services for them to come to our center, and also accommodations. We have concierge services that can help them with accommodations as they stay in San Diego for the duration of their treatment. So we really want them to feel at home. We want them to feel welcome. We also want to make sure that we're always available to them should they need us, and they can always reach someone if they have any questions or any concerns. And I think Chinese patients have felt very, very comfortable, very confident as they go through their journey to parenthood.
It sounds SDFC is very ready to meet more Chinese patients and intended parents.
Absolutely, we are ready to welcome them.
So, Dr. D, I think one great thing about SDFC is that you have your very own egg donation database,
Yes.
which I know many other clinics don't have.
Yes.
So what benefits can SDFC's own egg donation service bring to our intended parents from China?
You're absolutely right, Jerry. So one of the things that we have is, unlike many clinics, we're one of the few clinics that offers our own egg donor database of patients. Mm-hmm. That means that when patients are looking for a great egg donor, they can actually go to our own website, access our database of over 200 pre-screened egg donors to help them in their journey to parenthood. Now, one of the great things about our egg donor database is that all of the egg donors have been pre-screened for ovarian reserve and egg quality. And many of them are repeat egg donors, so they've already had their genetic screening done, psychological examination, so they're really ready to donate eggs again should our intended parents select them. The other advantage is that we don't have an agency fee. We don't charge our patients an agency fee to present them with our egg donors. So that also can be a big financial savings for patients when they choose an egg donor from our database. We have an egg donor team that is always available to our patients and intended parents in China so that they can help them find the ideal egg donor, or if they have more questions about the background of the egg donor, or more information medically or socially about our egg donors, we're always available there to be able to provide that information to our intended parents. So I think overall it's a great service that we offer, and it's a very special benefit that we offer to our intended parents. The egg donor database is not open to any other patient or outside clinics. It's really our own egg donor database for our own intended parents.
Wow, think about that. A big egg donation database with all the medical approved egg donors,
yes,
plus some financial advantages. That will be very attractive to our Chinese patients.
Yes, I agree with you.
Dr. D, I know you have very extensive experience in providing third-party reproductive services, and also SDFC is a very LGBT-friendly clinic in the United States. So would you please share with our LGBT intended parents some of your advices before they start their American baby journey?
Absolutely. We really welcome our LGBT intended parents to our center. We have extensive experience all around the world, in Europe and South America and Canada, in Asia, in China in particular, with intended parents, intended fathers, intended mothers who are going through the journey to parenthood. We help them pick, for example, for our intended fathers, we help them select their ideal egg donor. We work with our colleagues and USIB to help them find their ideal surrogate, to prepare the surrogate for the embryo transfer. And of course, we also welcome them in the clinic, for their sperm collection and their FDA screening, as well as our intended mothers when they want to come there for their IVF cycle, or if they want to use a particular surrogate. So we have a very extensive experience in LGBT fertility care, and really welcome our intended fathers and intended mothers from China with open arms. And because of our extensive experience, well over 15 years of helping the LGBT, we feel the San Diego Fertility Center is a great center to welcome them and to help them on their journey to parenthood.
Thank you so much. Thank you again, Dr. D, for joining our conversation today. So we talked a lot about the services and technologies in United States in fertility treatments. Especially we talked a lot about what services can SDFC provide for our Chinese intended parents. Thank you.
Absolutely. It's really been my pleasure to spend this time with you and with our intended parents from China. We really are excited to welcome you to our center. We have a beautiful center, state-of-the-art facilities with a China team that's waiting to welcome you and help you on your journey to parenthood. And really, I wanted to thank USIB and Jerry for this opportunity to be able to tell you a little bit more about San Diego Fertility Center and all the services that we offer.
再次感谢您收看今天的与超级医生对话栏目，各位朋友，我们下次再见。